Good evening. My name is Tom ROLOFF, and I'm the chair of the National Brain Tumor Society Board of Directors. I'm also a brain tumor survivor and a proud member of this extraordinary community dedicated to conquering and curing brain tumors once and for all. On behalf of all of us at NBTS, I want to welcome you to tonight's program, which we're calling a Catalyst Moment. It is indeed a pivotal moment for our world, our nation, and our brain tumor community. National Brain Tumor Society rose to the challenge in 2020, making real, tangible progress in the face of unprecedented global crises and enabling patients and healthcare providers to adapt to medical and research challenges presented by the pandemic. That said, due to this crisis, we were not fully able to bring forward some of the most promising research initiatives that are ready to begin. With urgency and unrelenting drive, we will not be satisfied until the fight to conquer and cure brain tumors is over. That's why tonight, we're launching the most ambitious year-end campaign ever, the Catalyst Campaign, designed to ensure that we enter 2021 with the strength and resources necessary to deliver our mission with the greatest possible impact. Tonight, you'll hear from catalysts in our community about the many ways they're helping in the fight to conquer and cure brain tumors. I hope you'll be inspired to join us. Together, we can ensure that 2021 is an even stronger year of breakthroughs, change, and hope.
Hi, everyone. Thank you for joining us tonight. I'm David Arons, CEO of National Brain Tumor Society. In a year like no other, you and the NBTS community have been simply amazing and inspiring. When the pandemic spread in the early spring, there were a lot of questions, a lot of uncertainty, and a lot of worry among patients, caregivers, and medical teams. There were new risks to brain tumor patients due to COVID. Questions about how to access medical care when hospitals and clinics were overwhelmed. Uncertainty as to whether clinical trials and vital research would continue. And we had to make immediate changes in how we connect with one another when so many of our gatherings typically happen in person during walks, rides, and events. Thanks to you, your organization, National Brain Tumor Society, we were able to quickly pivot and adapt, putting patients and caregivers first. One of our main priorities was to keep the work towards finding a cure moving forward. We, and when I say we, I mean you too, as a vital part of NBTS. We launched new promising research projects focused on pediatrics and adults, even during COVID. We virtually gathered with neuro-oncology leaders from across the country, hospitals, associations, the NIH, the FDA, and biopharmas to develop very specific action plans to enable clinical trials to continue and collect good data. The NBTS supported GBM Agile clinical trial program, adapted to the COVID challenge, and actually expanded this year and is enrolling patients right now. Another priority was to connect you and one another to critical resources in a new socially distant world. We moved all of our events online, including Head to the Hill and Glioblastoma Awareness Day. We expanded our monthly virtual brain tumor support conversations, and we organized brain tumor-specific resources to help patients understand and cope with COVID. Finally, we adapted our entire advocacy program to successfully be able to influence Congress and secure millions of dollars for brain tumor research through the federal government, and passed by unanimous vote in the U.S. Senate the Glioblastoma Awareness Day resolution. Now let me level with you. National Brain Tumor Society was not able to launch some of its most promising research projects this year due to the single greatest drop in revenue we've ever faced as an organization as a result of COVID. Like many nonprofits, we've also made painful cuts to staff and other programs. Throughout this crisis, we have said that it's not enough to just survive COVID. We as an organization must also innovate. We have to innovate, we have to evolve, we have to emerge even stronger. We're not yet out of the woods on COVID. We have a ways to go, but we must be determined and dauntless about pursuing our mission of conquering and curing brain tumors once and for all. With your help, by being a catalyst, starting tonight, we will be ready to advance some of our most important work ever in the coming year. I want to share with you 3 of our top priorities for 2021. Number 1, we need to act fast to evaluate some of the most promising treatments in development. There are new classes of potential therapies for a wide range of brain tumor patients in adults and pediatrics that NBTS scientific advisors believe can stop tumors from growing and that are working in other cancers. NBTS Defeat Brain Tumors program is poised to evaluate these drugs and send the best forward into clinical trials. We have teams of world-renowned researchers ready to act together and move fast. These projects are entirely ready to go, and their work could help patients as early as next year. Number 2, we need to ensure the best medical care for brain tumor patients. COVID has changed the way medical care is being delivered, and NBTS is convening and is leading an advocacy agenda to build upon the lessons of COVID and learn and make brain tumor healthcare better than before, as well as accessible and affordable. NBTS is already planning for changes in our government and is prepared to work with governmental leaders and bring up our agenda forward. Number 3, we must continue to unite and deliver hope to the brain tumor community. Together with you, the NBTS community, we will continue to honor loved ones, help connect patients, families to each other and to experts, and grieve for family members who have succumbed to brain tumors. Across our initiatives, whether they be live or virtual, we will foster that hope, provide information, and deliver real and tangible ways to improve life with a brain tumor. We will ensure that no one has to face a brain tumor diagnosis alone. They have us as an NBTS family. Like you, the National Brain Tumor Society does not retreat when times get tough. Together, we can rise up, we can innovate, we can stand strong, and we can deliver for the brain tumor community. We need your support to be able to do it. Tonight, I'm asking you to be a catalyst, a change agent, a leader, a uniter, an igniter of support and hope, and give what you can this holiday season to ensure that our urgent work continues to advance in 2021. Thanks again for your enduring support and for being part of the NBTS team that is truly unrelenting in our work to bring about cures. Please be safe, be well, and know that NBTS is always here for you.
Hi, my name is Elizabeth HEISLER, and I work with brain tumor patients and families as a physician assistant with PENN Neurosurgery. I support the National Brain Tumor Society because it has taken real action towards developing new brain tumor treatments by funding over $38 million in brain tumor research grants and awards, and because it has been an advocate for public policies benefiting brain tumor patients. I also know their staff sincerely believe in the mission of finding a cure and work hard every day to ensure patients and families are connected with helpful resources and have support to navigate what can be an overwhelming system in finding the proper treatment and support systems. So join me and be a catalyst for hope.
Hello, my name is George Farrington, and when I was 22 years old, I lost one of my best friends to a brain tumor. Nearly 6 years ago now, I became a brain tumor survivor myself. I support the National Brain Tumor Society not only for their unwavering dedication to finding a cure, but also for their compassion and their willingness to be a loud and proud voice for brain tumor patients, survivors, their families and caregivers, and those who have been lost. So please, join me and be a catalyst for change.
My name is April. My husband Mike was diagnosed with an astrocytoma in September 2019. I support the National Brain Tumor Society because together we can find a cure for brain tumors and give hope to futures like ours. Join me and be a catalyst for hope.
My name is TRACEY HANOVER. I lead global advocacy for NOVOCURE, a patient-forward company striving to improve survival in some of the most aggressive forms of cancer. I've had the privilege of supporting the glioblastoma community over the past 10 years. I support the National Brain Tumor Society because we share a common goal: to advocate for patients and care partners and deliver treatment options to patients living with cancer. At NOVOCURE, we recognize the great importance of patient advocacy in advancing treatment options. Join me and be a catalyst for change.
Hello, I'm Dr. RANJIT BINDRA. I'm a professor in the Department of Therapeutic Radiology at the Yale School of Medicine, and I'm a co-director of Yale's Brain Tumor Center. My laboratory is dedicated to developing novel therapeutics for the treatment of brain tumors. I'm proud to partner with the National Brain Tumor Society because they make research possible. We can't do anything we do in the lab without their support. Join me and be a catalyst for a cure.
Hi, my name is Sarah Durham, and I'm the former chair of the National Brain Tumor Society's Board of Directors. I lost both my parents to glioblastomas, and I support the National Brain Tumor Society because I want to be a part of the change that is going to conquer and cure brain tumors once and for all. I want to contribute to making this a better and safer world for people in the future who are affected today and who might be affected tomorrow by brain tumors of all kinds. So please join me and be a catalyst for change, because together we can conquer and cure brain tumors once and for all.
Hello, my name is Stanley Allen, and in 2012, I was diagnosed with a benign brain tumor to my left temporal lobe. This was my first time experiencing anything of this magnitude, and this is how I got connected with brain tumors in general. For the past 5 years, I've been working alongside the National Brain Tumor Society to come up with a cure, ways to raise awareness, and to help people in our community that has been affected. I've had a grade A recovery, but everyone isn't so lucky. I'm asking that you join me and be a catalyst for change and hope, so we can ultimately find a cure for this disease. Thank you.
My name is Christy Jones. My husband was diagnosed with an inoperable glioblastoma brain tumor, and we spent years fighting this terrible disease until he sadly passed away 3 years ago. I support the National Brain Tumor Society because they are an organization whose mission it is to cure and conquer all brain tumors by funding research and supporting the communities and families who are going through this right now. So join me and be a catalyst for a cure.
Good evening. My name is Michael Nathanson, and I'm the former chair of the National Brain Tumor Society's Board of Directors. It has been one of the greatest honors of my life to serve this extraordinary organization. And I'm here this evening to ask you to join me in taking action to advance a mission that means so much to so many of us. You've heard tonight from many catalysts across our community: patients, families, researchers, advocates, healthcare professionals, and champions about the many ways they are helping to conquer and cure brain tumors. There's no question that this year has posed challenges on many fronts. But if there's one thing our brain tumor community is known for, it's determination. And through the COVID crisis, the National Brain Tumor Society has continued to drive research and advocacy forward while helping families, including some very close to me, who are new to facing a brain tumor diagnosis. We know what it takes to face unprecedented challenges, and we know that we cannot and will not waver in our support of this urgent mission. The stakes are too high, and we've come too far to stop now. There is incredibly promising research still to be funded. There are major initiatives poised to change the landscape for how brain tumor patients access care and improve their quality of life. We are at the precipice of a major era in brain tumor progress, and we must come together in this catalyst moment to ensure it is realized. My ask of you tonight is simple. Be a catalyst. Join me in making a gift to ensure that the urgent, unmet needs of the brain tumor community continue to be heard and addressed. Visit braintumor.org to make your gift now and share on social media to invite your friends and family to join you. Together, we can ensure that 2021 is an even stronger year of breakthroughs, change, and hope. Thank you.
My name is Radia, and I am a member of Students Supporting Brain Tumor Research. We fundraise for the National Brain Tumor Society and bring awareness to the public about brain tumors. I support the National Brain Tumor Society because they fund research all over the world in understanding brain tumors and finding better cures and treatments. They strive to achieve results and bring greater impact to the brain tumor patients. Join me and become a catalyst for hope.
My name is LATRESA Dolman, Ms. America International. I was the caregiver to my beloved husband, Pro Football Hall of Famer, Chris Dolman, who passed away from a glioblastoma in January. My husband was the most loving man I've ever met, and I miss him dearly. I support the National Brain Tumor Society because I love the work that they do. They provide support and helpful information to patients and caregivers. They also invest in research for treatments and to find a cure. Please join me and be a catalyst for a cure.
My name is Alexandra. About a year and a half ago, I was diagnosed with a grade 3 oligodendroglioma. I support the National Brain Tumor Society because they support research looking at oligodendrogliomas, when historically there hasn't been much research geared towards this type of very rare cancer. The National Brain Tumor Society is working to change that. Join me and be a catalyst for a cure.
Hi, my name is Jaden Shaw, the Chief Medical Officer at Karyopharm. We at Karyopharm are committed to working with the National Brain Tumor Society, physicians, and patients to improve outcomes of patients with brain tumors. Join us as we study selinexor across trials in the U.S. We support the National Brain Tumor Society because we have a shared vision to improve outcomes of patients with brain tumors. Join me and be a catalyst for hope, a hope for a brighter future.
Hi, my name is Megan. My grandfather passed in 1997 after a 16-month battle with stage 4 glioblastoma. I am a supporter of the National Brain Tumor Society because of their unwavering voice in Congress that says that increased medical research funding to NIH and NCI is essential for making breakthroughs in new treatments and better quality of life for brain tumor patients. Join me and be a catalyst for a cure.
My name is Lita Ramadan. My father, Amin Ramadan, suffered from a brain tumor that caused him a great deal of pain and suffering in the final years of his life. It also caused my family a great deal of pain and suffering as well. Because of that, we are committed to doing whatever we can to help make a difference. We support the National Brain Tumor Society because they are on the verge of making major breakthroughs and finding better treatments and ultimately a cure. Join me and be a catalyst for hope.
My name is Lisa Lenro. My husband, John, was diagnosed with a glioblastoma in October 2018. He fought every day to beat cancer, but my beloved lost his battle on July 19th, 2019. I support the National Brain Tumor Society because I want John's diagnosis of a grade 4 GBM to make a difference. NBTS works relentlessly to find effective treatments and provide support services for patients and caregivers. Join me and be a catalyst for a cure.
Hello, my name is Dr. Eva Galanis, and I'm a member of the National Brain Tumor Society Board of Directors. I'm a medical neuro-oncologist and brain tumor researcher at the Mayo Clinic. I'm passionate about finding answers for our patients with brain tumors by bridging the best science with the best clinical care. I support the National Brain Tumor Society to find a cure and in the process change the lives of our patients through outreach and advocacy. Join me and become a catalyst for a cure.
Hi, my name is Nitin. In 2014, when I was 12 years old, I was diagnosed with medulloblastoma, a cancerous brain tumor on my fourth ventricle. I went through brain surgery to remove the tumor, radiation and chemotherapy that lasted a little over a year. I support the National Brain Tumor Society because of the critical research and the awareness that it brings to an issue that is so close to my heart. And I know firsthand the struggles that brain tumor patients go through every day. Each year, the Race for Hope 5K shows us all the hope and courage out there in support of such an amazing organization. So join me in being a catalyst for hope.
Be a catalyst for change, be a catalyst for hope. Be a catalyst. Be a catalyst for hope. Be a catalyst. Be a catalyst for hope.